the Patients for Patient Safety program. Susan.
Good afternoon. First of all, it is a remarkable honor to stand up here and represent patients from all over the world. And I'd like to thank the World Alliance, Sheridan Donaldson, Dr. Gwande, HRQ, mi amigo Orlando de Costa Rica, Pajo, and Tim Evans from WHO. It's important to recognize the voice of the patient at this launch. The World Alliance for Patient Safety of the WHO has boldly chosen to position the patient at the core of all of its activities. This is very courageous and potentially powerfully transformational. As Dr. Gwande mentioned, I lead the Patients for Patient Safety program of the Alliance that celebrates and values the voice and the role of the global patient. We, Patients for Patient Safety, envision a different world in which healthcare errors are not harming people. We are partners in the effort to prevent all avoidable harm in healthcare. So we come together in dialogue, participating in care with providers. We unite our strength as advocates for care without harm in the developing as well as the developed world. Recognizing that harm from surgery is indeed a global problem, on behalf of Patients for Patient Safety, I am here to give voice to those who have suffered, to those who have been silenced, and to those who are now unheard as a result of unsafe surgery. Patients for Patient Safety is the voice of Liesl from the United Kingdom, who had an operation meant for another patient due to the failure of the surgeon to check Liesl's identity band. When I spoke with Liesl, she shared with me that she wanted to know how this could happen and why this could happen. And she wanted to make sure this could never happen again. And she called for changes at the hospital and her healthcare system so it would never happen. We are the voice of Mohammed from Egypt, whose young wife died from excessive blood loss during a routine surgery, who gave a very impassioned speech last March at a patient workshop. And he was calling for new rules and life-saving procedures. We are the voice of Natividad from the Philippines, who sadly died from 2 retained gauze strips after a hysterectomy. We are the voice of Joan from the United States, mother of 3, who died during gallbladder surgery after anesthesia alarms were turned off during her surgery, and the clinicians did not detect her deteriorating condition. We share our stories to illuminate, to teach, to inspire, and as a call to action. We bring data to life. We are real people, not just statistics. We are powerful reminders that harm from surgery can happen at any time, to anybody, anywhere in the world, regardless of what language we speak or the economic status or government from the country that we come from. Harm from unsafe surgery knows no borders. We, Patients for Patient Safety, are committed to spread the word about this checklist from person to person, from town to town, to country. Going forward, Patients for Patient Safety will unite patients, patient organizations, providers, professional groups, and others globally to embark on a new, robust initiative that will educate the patient population regarding safe surgery and ignite patients to insist on the implementation of this checklist. Because this will save lives. And quite frankly, patients have the greatest at stake. Just imagine what we could accomplish working together. The opportunities are enormous, and they are at our fingertips. So we challenge you, we invite you to partner with your patients, inform your patients about this checklist. And we ask you to bring your knowledge, your power, your wisdom, your strength, and your passion to this campaign, and make safe surgery a reality. Mary Hardy was using the statement, the what if. So I think that as well, what if? Well, for Liesl, the checklist could have ensured that the right patient received the right operation. For Mohammed's young wife, the checklist could have ensured that blood loss was considered. For Natividad, the checklist would have created team spirit and halted the completion of the operation until the swab count was complete. And for Joan, the checklist would have identified the equipment failure, and she today would be with her family. So in honor of those who have died, those left disabled, our loved ones today, and the world's children yet to be born, we will strive for excellence so that all involved in healthcare are as safe as possible, as soon as possible. And this is our pledge of partnership. So this launch has been a momentous event. But what really matters is what we do when we go home to our families, to our offices, to our hospitals, to our countries. So I feel compelled now to end with a quote, because everybody else has ended with a quote. So one of my favorite quotes, and my colleagues' favorite quotes, is, and it was actually by an architect from the late 1800s from Chicago. And that quote is, as we leave this event, remember this quote, "Make no small plans, for they have no magic to stir men's blood." So as we all leave today, every one of us indeed needs to leave with big plans to make a difference. Thank you.